Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. In this video, we're going to talk about gender and borderline personality disorder. And what you believe about gender and BPD is likely wrong. There is a misunderstood belief that women have BPD more often than men. Now, there are old studies that show that about 76% female and 24% male. But these old studies are actually flawed due to sampling and other methodological errors. This error is even published in the DSM-5, which is the medical diagnostic Bible, so to speak. Now, more research studies, more recent ones, show no gender differences when controlled for these errors. Now, this video is directed at clearing up this confusion to help you understand and recognize these differences. We're going to talk about trait expression. We're going to talk about what it looks like in the male population, and so that it can give you a better idea if you may think that you have it. Now, of course, this video is not to diagnose yourself, but to give you a little more insight and a little more understanding about what these features are, and also to hopefully break some of that myth and confusion about BPD. And if you like this video, subscribe, thumbs up it. You can hit the little bell there if you'd like. That'd also be great. And if you're interested in this topic more, there are always citations related to the topics that I cover, and that is at the bottom of the comment section as well if you want to learn more. So let's get into it. Here we go. Now, the gender problem persists as we believe that BPD presents in the same manner for both genders. Now, by doing this, we miss some key distinctive factors to identify BPD in males. A lot of the confusion resides in females being diagnosed with BPD who actually meet criteria for antisocial personality disorder. And a lot of males that actually have borderline personality disorder are misdiagnosed with antisocial personality disorder. Now, let me clarify something. This does not mean that individuals that have borderline personality disorder also always have antisocial personality disorder. There is a subgroup of individuals who have borderline personality disorder, antisocial personality disorder, so they're comorbid, they're occurring together. But that's not what I'm talking about here. I'm talking about misdiagnosis, is that we see individuals, perhaps females, that have more antisocial traits. But because of that acting out, because of that quick to anger and maybe harming others and suicidal threats and other issues, that person who should be diagnosed, who actually has antisocial personality disorder, is misdiagnosed with borderline personality disorder. That adds to the confusion. And then we have men who may present with borderline personality disorder, which is a sense of abandonment. Perhaps they hurt themselves, multiple suicide attempts, other types of issues that we're going to talk about here. And they are misdiagnosed with antisocial. But they actually would qualify for borderline personality disorder. And it's important to make this distinction because treatment recommendations and treatment approach is different, vastly different for these two disorders. And let's talk about what those distinctions are in men and women as it relates to borderline personality disorders. Now, men with BPD are more likely to have comorbid, narcissistic, antisocial, paranoid, and schizotypal personality disorders, as well as alcohol and substance abuse disorders, but they are less likely to have dependent and obsessive compulsive personality disorders when they're compared to women with BPD. Now, for those who may not know what schizotypal personality disorder is. Schizotypal personality disorder, this is characterized by discomfort in close relationships, cognitive or perceptual distortions, and eccentricities of behavior. So these folks tend to see the world and operate within it in a very unique way. I'll be doing a video in the future on schizotypal personality disorder and borderline personality disorder in the future. But right now, let's kind of stay on topic with gender and BPD. Now, if you're interested in obsessive compulsive personality disorder, I did a video on that as well. Put the link right here for you. Now, men with BPD are at a higher risk of dying by suicide compared to women with BPD. Now, this is due to the tendency to use more lethal means in suicide attempts compared to female suicide attempters. However, there is no difference between men and women who attempt suicide or the number of suicide attempts made. So it's just in the lethality. It's not necessarily just the number of attempts, but in the lethality of the attempts. Men tend to engage in more lethal means than women do. Now, additional factors in males, this includes tendency to take offense easily and act out aggressively, control others through criticism, possess a lot of irrational jealousy, possessive of others, but emotionally detached, and they use sex to relieve insecurity. Now, just because they're higher in males, that doesn't mean that it doesn't exist in females. There's just a higher tendency in males. Okay, so it's important to realize that as well. Now, I just want to jump to neurology for a second. Now, neurobiological studies comparing BPD patients with gender-matched healthy controls. So you have individuals with BPD, and then you have gender-matched controls. These are folks who don't have BPD. Now, showed a number of interesting gender differences. Now, this is a reduced amygdala and hippocampal gray matter volumes in female patients that were not seen in males. Now, males with BPD exhibited reduced gray matter volume of the anterior cingulate cortex, increased gray matter volume of the putamen, reduced striatal activity during an aggression task, and a more pronounced deficit in central serotonergic responsivity. Now, these neurobiological findings point to a particular importance of impulsivity for the aggression of male BPD patients. Okay? Now, what does all this mean straight up? What are we talking about? This is that males with BPD have different brains than females with BPD. But we must recognize more data and research needs to be done in this area. Just because we know that there are brain differences doesn't mean that we can be hard and fast and overgeneralize. That's a huge problem with BPD and individuals who do have the disorder and that are on that borderline personality disorder spectrum, is that there's too much generalizability. Everybody is assuming that they're the severe cases, all just massively violent and self-harmers and just destructive and all of that. That's a small group. There are some folks who engage in those behaviors, but maybe not to the same drastic degree that it is publicized in movies, TV, and even in the understanding of a lot of mental health providers as well. So we got to work to debunk those myths. And so we talked a lot about gender and gender differences in BPD. And if you're interested, if you want to learn more about male BPD, there's a book by Dr. Joseph Nowinski, and it's called Hard to Love, Understanding and Overcoming the Male Borderline Personality. And it's really good. I've read it. I like it a lot. I think it's very interesting. I will put a link to that in my comments if you want to check it out. I thank you very much for your time and attention, and I hope you found this useful. Please leave any comments in the comments section that you may have. If you like the video, subscribe or check out some of my other ones. And thank you very much for your time and attention as always. Take care. Bye-bye.